Hello, welcome back to another video. What's up, Doc? This is part 2 of the process series. So if I would be talking to a new graduate, seniors or even juniors, which is the third year or the fourth year in dental school, the first thing I would ask, why dentistry? All these new dentists that they are waiting to graduate and get into the workforce, I'm sure they're very excited to jump into it and plunge right in to practice what they have learned for 4 years. And also, of course, there's a finance component part of it, having loans, having debt, and we are eager. I was eager when I came out is to start paying my loans, start paying my debt, so I can move on building my finance, my credit, my portfolio, so I can live. I can support my family and buy a house and make all my dreams come true. But why dentistry? What inspired you to get into dentistry? What attracted you towards the dental world? And in order to ask the question, you can just check those boxes. Do you love to work with your hands? A lot of people are very creative in working with detailed procedures. Gives them a lot of satisfaction. That's very rewarding. Being creative, creating new teeth, creating new bites, creating new jawline, creating new smiles. That's the creativity part of dentistry. Is that what attracted you to the dental world? Or do you love to talk to strangers and make them feel really comfortable and manage and navigate through their anxiety and their emotions? Are you in it because you are excited about the technology? You are the type of dentist that you're going to equip your office with all different technologies, going to make you do as much as possible or advance dentistry as much as possible. Is it passion for healing? Are you passionate about healing people's conditions and taking away their pain, taking away their fear and anxiety? Or you're attracted to it because it's such an OCD environment. Dentistry is very much an OCD environment because everything that we do in dentistry, as you know, is very technique sensitive. And in order to satisfy that sensitivity, you need to be very much on board with being OCD. It's a healthcare facility. It needs to be spotless. It needs to be sterilized. It needs to be disinfected. So if you're not OCD, you're not paying attention to detail, then you're going to have a hard time with that field. If you checked all these boxes, technology, loving people, loving to create, love to work with your hands, the passion of healing and fixing, then you are in the right profession. If you haven't checked any of these boxes and all your answer is I'm in it for the money, then good luck. Because it's not that easy and it's not that simple. But at the same time, you can do dentistry 2 different ways. In my opinion, there are 2 types of dentists. Either you can get fixated by healing people and fixing people, and that's all you know, that's all you want to do, and you have no other interests whatsoever. You are going to have a hard time phasing out, slowing down, and letting go later in the future. The other way of doing it is, nope, I'm in it for the money. All I'm going to do, I'm just going to produce. I want to push really hard to learn all these cases. I want to do a full mouth reconstruction. I want to do Botox. I want to do Invisalign. I want to do root canals. I want to do extractions. I want to do surgical. I want to do flaps. Because you are driven by the materialistic reward of that profession, which is great. I mean, obviously, all of us are in it because we want it as a career. The money is great, but it needs to be more than that. Now, you have the option. It's your decision. You can make a conscious decision and say that, no, I'm just going to focus on the bottom line every single day. What that's going to do is going to build a lot of resentment from your patient and from the team too. So it's okay to be fixated on the bottom line at the end of the day, but how to do it, how to approach something like that, it's very important to understand, realize, and also exercise in order for you not to deal with a resentment early on in your career, and then before you know it, people are not cooperating, people are not team, or patient, they're not compliant, they're not cooperating, they're not listening to you. So be very, very careful if you are very much money driven, for that career or from that career, then you have to do it in a very subtle, humble way. Humble beginnings are very important in dentistry, I believe, in my opinion, because if you are not ready to create humble beginnings, then you're going to drive yourself crazy. You're going to refuse to go through the process, and you're going to more focus on the what and the how. What's that going to do is going to make you stumble. Everybody's going to stumble and fall and make mistakes and pick up, and hopefully learn from it and go back to your design table, as I call it, and redesign your way, redesign your approach, you redesign your conduct so you can be better and more productive and more successful. I want to teach you guys how to become the best clinician you can ever be, in moderation, with the balance of your spiritual health, your mental health, your physical health, your finances, your relationships, your conduct, your personality, your perception. Especially these days, it's very important for somebody who's graduating from dental school, brand new, to realize that these are the expectation of the public. And I mentioned in the video, a previous video, is working with the public as an experience, like in a public clinic or a nonprofit organization that takes care of patients, dental needs, or even a residency. I don't even know if the residencies do exist these days or not. I did a whole year of residency after dental school, and it just taught me so much. They teach you speed. You have to get fast because just the demand is so high, especially of these clinics. You need the balance. Try not to skip the process as much as you can. Even if you pick certain aspect of the process that you like and you can exercise it and practice it, it's gonna give you so much knowledge and so much experience. Especially these days, there's so much fakeness out there. And what I'm seeing these days is patients are really losing the trust, which is very unfortunate. I'm going to speak about it in the future, because we are trying to change the stigma of dentist. I hear from patient either dentists don't care about me, they just want the money, or this dentist is wicked, so nice, people are walking all over him or her. And you have the extreme. You want to be kind of in the middle. You want to be give and take. Okay, you want to be giving the attention that whoever needs it, and the intensity and the consistency in whatever you're doing. Or you can even also ease out too. You can pick and choose. You have to be very selective in how to conduct yourself towards certain people. Treating team is different than treating patient. Treating patient is different than treating your own family. So the two worlds gonna mix. The longer you're gonna practice, you feel that both worlds are just gonna start mixing around. Your work is gonna, intervene into your personal life. Your personal life is gonna intervene into your work life. So you have to have a balance, and that's what the process gives you. The process will teach you how to balance your life. So when you're done with dentistry and you're exiting out, you're not dealing with so much trauma, so many scars, so many wounds that you're trying to heal with. And before you know it, I worked for 25, 30 years, 40 years. I have dentists that are still working. And I don't know anything else but that. You want to register a great experience with dentistry, that when you feel like you're about to exit, you said, you know what, I did the best I can, I had a great life, and it was all balanced. Everything was done within moderation. Everybody's happy. My family's happy, I'm happy, my team is happy, and the future dentists are happy too. So like I said, trust the process. Try as much as you can, especially if your beliefs do not agree with the process. Try maybe to pull couple of things from the process that can help you cope and help you stumble less and do less mistakes, because that's how we learn. That's it for now, and I hope to catch you in the next video.